Do you actually know what normal breast size really means? Or whether the size of your breasts says something about your health? Many women worry about whether their breasts are too small or too large, especially as they age. It's important to understand that there is no single standard that applies to everyone. The size, shape, and firmness of breasts can vary significantly from woman to woman and depend on many factors: genetic predisposition, weight, hormones, and of course, the natural aging process. Small or large breasts do not tell anything about your health or your femininity. However, self-examination of the breast is an important step in early detection of changes, regardless of your size. Many women are unsure how to properly feel their breasts, what changes are normal, and when it is better to see a doctor. And that is exactly what we will talk about today. Let's start with a question: how to properly perform a breast self-exam, and why is it so important? The breast consists of glandular and fatty tissue, as well as many lymph nodes and blood vessels. Changes in the breast, such as lumps or hardening, can be the first signs of benign changes, or, unfortunately, breast cancer. Regular palpation helps you become familiar with your breasts and immediately notice when something is different than usual. It is important to perform self-examinations once a month, preferably 1 or 2 days after the start of your period, or if you no longer have periods, every month at the same time. You should perform the examination standing in front of a mirror and also lying down. You don't need any special equipment, just your hands and some time for yourself. Start the self-examination preferably in front of a mirror to thoroughly examine your breasts. Look for visible changes such as skin dimpling, changes to the nipples, redness, or swelling. It is normal for your breasts not to be perfectly symmetrical, but sudden or noticeable changes should be taken seriously. Then, lie comfortably on your back, as this spreads the breast tissue flat and makes it easier to feel. Use the pads of your 3 middle fingers and systematically palpate your breast. It is best to proceed with small circular motions, starting from the outer part of the breast and moving towards the nipple. Make sure to check both the outer areas and the nipple itself, as well as the tissue directly under the armpit, because there are many lymph nodes there as well. Take your time and apply light, medium, and also somewhat firmer pressure to palpate different depths of breast tissue. Each level of pressure helps reveal lumps that might otherwise go unnoticed. If you find a lump that is new, immovable, or feels hard, you should definitely see a doctor. Many women confuse normal structures, such as small lumps known as fibroadenomas, with pathological changes. They are usually benign and common, especially at a younger age. However, even if you regularly perform self-examinations of your breasts, these examinations do not replace an annual preventive checkup with a gynecologist. A professional examination by a gynecologist ideally complements your self-examination. During this, the breasts are not only palpated, but often an ultrasound examination is also performed, which is very informative, especially in dense breast tissue. For women over 50, mammography, an X-ray examination of the breast, is often recommended to detect changes early that cannot be felt by hand. Another important piece of information is that the size or shape of the breasts does not play a role in the development of breast cancer. Both large and small breasts can be affected. Changes during the cycle or after menopause are usually hormonally driven and often harmless. However, every woman should be attentive and listen to her individual bodily sensations. It is during menopause that breast tissue often changes. It sags, the proportion of fat increases, and glandular tissue may recede. These changes are completely normal and can cause the breast to feel softer or different than before. Therefore, it is especially important to regularly check the breasts and notice any changes early. One more tip: when performing self-examination, also pay attention to the skin of the nipples. Small indentations, discharges, or redness should always be examined, especially if they appear suddenly or persist. Symptoms of breast cancer are not always painful, often very subtle, and can only be recognized through careful observation. An important part of breast self-examination is also checking the lymph nodes in the armpit. Many lymphatic channels run there, which can enlarge with certain illnesses. To do this, slightly raise your arm or place it on your head to relax the muscles. Then, gently palpate the armpit with your free hand using small circular motions. Notice if you feel hard, movable, or tender lymph nodes. If you notice swollen lymph nodes that cannot be attributed to a benign cause such as a cold, or that persist for several weeks, a medical consultation is urgently recommended. Rarely, changes in the breast or lymph nodes may be signs of serious illnesses. In addition to regular self-examinations, there are several things you can do to support the long-term health of your breasts. Maintain a balanced diet rich in fresh fruits and vegetables, get enough exercise, and avoid overweight. A healthy lifestyle positively affects your overall hormonal balance and consequently, your breasts. Avoid excessive alcohol consumption and smoking, as both can increase the risk of breast cancer. Wear comfortable and well-fitting bras to support your breasts optimally and prevent injuries or tension. Especially during sports activities, specialized sports bras are recommended to protect the tissue. Additionally, it is advisable not to neglect medical examinations. Many women hesitate to regularly undergo mammograms or ultrasounds, especially if they have no issues. Preventive checkups significantly increase the chances of early diagnosis and can save lives. Nyní bych vám ráda přiblížila některé časté mýty o velikosti a zdraví prsou, které mnoho žen znejisťují. Now I would like to clarify some common myths about breast size and health that many women find unsettling. Rozšířeným omylem je, že malá prsa znamenají menší riziko rakoviny prsu než velká. A common misconception is that small breasts mean a lower risk of breast cancer than large ones. To tak úplně neplatí. That is not entirely true. Riziko závisí spíše na genetických faktorech, hormonálním stavu a životním stylu, nikoli na velikosti prsou. The risk depends more on genetic factors, hormonal status and lifestyle, not on breast size. Stejně tak si některé myslí, že kojení trvale negativně mění tvar prsou. Likewise, some believe that breastfeeding permanently changes the shape of the breasts negatively. Ve skutečnosti kojení dlouhodobě často zajišťuje pevnější prsa, protože stimuluje tvorbu tkáně. In fact, long-term breastfeeding often ensures firmer breasts because it stimulates tissue growth. Another myth is that frequent palpation could damage the breasts. On the contrary, regular self-examination sensitizes you to changes and can save lives. It is only important to use the correct technique to avoid unnecessary worries or incorrect diagnoses. If you're unsure, ask your gynecologist to show you the proper method. Many women also fear that breast cancer is always associated with pain. However, this is not true. Early stages are usually painless. That's why self-examination is so crucial to detect subtle changes early, such as lumps or skin changes. Pain often appears only in advanced stages of the disease. Another point that is often underestimated is the importance of breast care. Gentle skin care with moisturizing products supports elasticity and can help prevent tension and dryness. Avoid harsh soaps and shower gels that could dry out the skin. Regular physical activity also promotes blood circulation in the tissue, thereby supporting breast health. If you notice changes such as a new lump, retraction, or persistent pain, you should have them examined by a doctor immediately. An early visit to a specialist can often make a significant difference. The sooner the diagnosis is made, the better the chances of recovery. Let's also briefly focus on the role of hormones, as they play a key role in the size and structure of the breasts. Estrogen is the most important female sex hormone and influences the growth and development of breast tissue during puberty and throughout life. During menopause, estrogen levels drop sharply, leading to changes in breast tissue. The glands shrink, fat tissue increases, and the breast appears softer or more saggy. This natural process may worry many women, but it is a normal part of aging. It is important to know that these changes are not a disease, but an adaptation of the body. If you are considering hormone therapy, please discuss it in detail with your doctor, as such treatment has both benefits and drawbacks that need to be considered individually. Apart from hormonal changes, the shape and size of the breasts can also be influenced by other factors such as weight fluctuations, pregnancy and breastfeeding, or surgery. Each change is individual and demonstrates how flexible our body is. If you feel that the shape or size of your breasts is burdensome, consulting with medical professionals or specialized therapists may help find solutions that suit you. The last important aspect is the psychological component. Many women associate their breasts not only with physical health, but also with self-confidence and femininity. That is why it is so important to accept oneself with love and not to overly focus on perceived norms. Every woman is unique, and this applies to her breasts as well. Regular self-examinations, preventive checkups, and a conscious approach to one's own body are key to feeling good about breast health. And remember, health begins with attention and self-care. And now I would like to show you how to perform breast self-examination more accurately and systematically. Start by lying down and placing your right hand under your head to flatten the breast. Then take your left hand and use the pads of your 3 middle fingers to palpate the breast with small circular motions. Start on the outer side of the breast and slowly move toward the nipple. You should cover the entire area, including the tissue above the breast and toward the armpit. The movement should be thorough but not too strong to avoid causing pain. Watch for lumps, hardening, or irregular spots. It is useful to follow an order or pattern, such as from top to bottom or in a spiral from the outside inward. It is important not to miss any area. If you have difficulty locating the correct spots, you can ask for a demonstration during your next visit to the doctor. Remember to gently squeeze the nipple and check for unusual discharge, such as fluid. This could be a warning sign that should be examined. Then repeat the examination with your right hand for the left breast. This regular routine will give you confidence and help you recognize changes early. If you feel anything unusual during this process, do not panic, but schedule an appointment with your gynecologist or doctor for further examination as soon as possible. In addition to manual breast self-examination, there are supportive aids that can help some women better recognize changes. For example, special devices for palpating the breasts or thermal cameras can be used as an adjunct in certain cases. However, these technologies do not replace regular self-examination or medical prevention, but offer additional reassurance in cases of uncertainty or family history. Another important point is documentation. Keep a breast diary or use an app to record findings, lumps, or changes. This will make it easier for you and your doctor to monitor progress and respond promptly to changes. It is especially during hormonal fluctuations or before or after menopause that breast structure may change more significantly. If you have a family burden of breast cancer, such as close relatives with the disease, it is especially important to undergo regular and timely screenings. In some cases, doctors recommend additional imaging methods or genetic tests. Do not hesitate to openly discuss your medical history with your doctor to find the best preventive program for you. Finally, I would like to advise you not to be led by fear or uncertainty. Your attention to your body is a big step for your health. With loving and regular self-examination, combined with medical preventive checkups, you are best protected. Remember, you are not alone. Talk openly with friends or relatives about this topic and encourage other women to take care of their breast health. Together, we can raise greater awareness and detect and treat diseases early. In addition to physical examination, the emotional aspect of breast health plays a significant role. Many women feel fear or uncertainty when they notice changes or think about breast cancer. These feelings are completely understandable and human. It is important to seek support, whether from close friends, family, or professional counselors and doctors. Open conversations help to break down fear and better cope with the situation. Some women also find valuable support and exchange of experiences in self-help groups or specialized counseling services. It is important not to feel alone and to consciously make time for your own health, including mental health. A good mental state often has a positive impact on physical health. Stress, anxiety, or depression can negatively affect the immune system and the body's regeneration. Therefore, breast health should always be viewed in a holistic context. Take regular breaks, relax, and engage in activities that make you feel good. Mindfulness techniques or gentle physical activities like yoga can help strengthen your connection to your body and improve self-awareness. The better you know and feel your breasts, the quicker you'll notice abnormalities. This provides confidence and control. I want to encourage you to treat yourself with love and patience. breast health is a lifelong topic that we can actively influence. Small daily rituals and conscious self-care are valuable building blocks for this. Finally, I would like to give you some practical tips on how to support your breast health long-term. First, stick to regular self-examinations. Make it a monthly routine that you won't forget, whether on the same day of your cycle or at the beginning of the month if you no longer have menstruation. Secondly, make consistent use of preventive examinations. Seek advice from your gynecologist on which tests are individually suitable for you. This may include ultrasound, mammography, or other imaging methods. Problems detected early are often treatable. Third, take care of a healthy lifestyle. A balanced diet, regular exercise, and quitting harmful habits like smoking not only support your breast health, but also improve your overall quality of life. And fourth, speak openly about your concerns and fears. It can be in conversations with friends, family, or professionals. You don't have to carry these topics alone. A supportive environment can make many things easier and give you courage. I hope this information helps you feel more confident and well-informed when it comes to your breast health. If you have questions or suggestions, feel free to leave a comment. If you liked this video, subscribe to the channel and turn on notifications so you don't miss any important tips. Take care of yourself. Your health is the most valuable thing you have. Thank you for watching and see you next time.